Hi everyone, this is Neil Writer, consultant audiologist and director of Clearwax. Thank you for joining me in my latest video where we're demonstrating our latest innovation called the WAXscope. And this is of a patient who attended with bilateral, fully occluding, soft, impacted earwax, and they have very, very narrow and bendy ear canals. And for that reason, I'm using our smallest specular size, which is a size 1, which has an internal diameter of 3.5 millimeters. And do stay tuned for the left ear because that's the really, really narrow one. And as you can see, I'm just performing microsuction here, trying to loosen this wax. And this wax is lodged quite deep. So what the visible part of the wax where the suction probe is attached to is probably halfway into the patient's ear canal, and it extends all the way towards the eardrum. And you can see there's a bit of keratin here, and with the WAXscope it's got such great magnification and clarity. You can actually see the texture of the skin, all the lamellar texture and formation of the skin cells, and we managed to remove that. And you can just see the eardrum there appearing on the left hand side, that blue tinge. So that's the patient's eardrum. So this wax is now crumbling away. It's just a bit of wax at the top part of the ear canal, so I'm just going to adjust the focus there. And you can see that this wax is slightly matted. It got a few hairs that are embedded within the wax, and we managed to remove that last piece away. So we're now going to visualize the patient's eardrum, so you can see how narrow and twisty it is. I'm going to stretch the ear to the right. That's the patient's eardrum. There's a bit of a hair strand there. We're going to leave that, and yeah, the patient can hear significantly better. And this is their left side, so this is the even narrower ear, and the wax here, especially more laterally, is a bit more softer and a bit more mushy. So I'm going to instill some olive oil drops in a moment, and sitting and enveloping the floor of the plug of this wax is some thick dead skin, so keratin, so we're going to have to peel that away as well. So I'm just trying to move it away from the canal walls. It's just going to re-enter, stretch and straighten the ear canal. And you can just see that clarity we've managed to get with the WAXscope. So I'm going to lift it up off the floor. I can feel a bit of resistance here. So with the WAXscope, they've got 4 different specular sizes. This is the smallest one. To be honest, I feel that you can probably use this for most ears because it gives you access. And we've got the 4.25 millimeter, which is slightly larger, which I feeling will be the most popular actually. But I actually enjoy using the 3.5s. I can really get in deep into the ear and visualize the entire ear canal and eardrum. And we've got 2 larger sizes, a 5 millimeter and a 5.75. So we've got a size for all. You can use all ENT micro instruments as well, not just microsuction. So we've got our own range coming out soon. So hopefully I can demonstrate that to you. So you can see I used the olive oil spray, and this ear is really narrow there. And but even then we can visualize the eardrum, just stretching it and straightening it a bit. So the isthmus is quite narrow. And I hope you enjoyed that video, guys. So if you are interested in the WAXscope, please do email info@clearwax.co.uk. Thank you, bye.